Good Thursday afternoon. I'm Dr. Martha Buchanan, Senior Director and Public Health Officer here at the Knox County Health Department. April is National Minority Health Month, so our moment of gratitude today is dedicated to all our team members who are working to provide COVID-19 vaccine education and access to all community members, especially our underserved populations. And ahead of this very special holiday for so many, we also want to thank the Faith Leaders Initiative for their incredible partnership throughout the pandemic. They continue to provide not only comfort and support to our community during these challenging times, but also important health and safety information. Their partnership is critical, and we remain grateful for their efforts. We'll now bring you up to date on our vaccine information. We'll now bring up our vaccine information page. Today is another momentous day for the pandemic response. I'm pleased to report that there have been more than 204,000 vaccines administered in Knox County, or to Knox County residents. This significant accomplishment is due to the continuing partnership between the health department, hospitals, and medical providers across our community. In addition, nearly 29% of Knox County residents have been given at least one dose of vaccine, giving them some level of protection against COVID-19. We still have a long way to go, but I'm pleased with the progress we've made so far. This progress is due to our strategy to encourage as many access points for vaccination as possible in our community. We continue to encourage folks to look at all the opportunities across the area, whether that's hospitals, pharmacies, health departments, or medical providers' offices. And remember, getting vaccinated not only helps protect you, but it also helps protect your loved ones and friends who may be higher risk than you are. As a reminder, our new direct scheduling process for clinics will launch on Monday. This week, we're working through the last of the names on our wait list to offer them opportunities for vaccination first before we open the new process on Monday. We continue to encourage those interested in vaccination to check vaccinefinder.org for opportunities that are outside the health department and at the health department as well. Additionally, we've rolled out a new standby process for any leftover vaccines at the end of our clinics. This feature will be on our vaccine information page, accessible at covid.knoxcountytn.gov. Folks will need to sign up each day they are available, and will need to commit to being at a central Knox County location at the end of the day, which for us is like 3:30, 4 o'clock into the day. That's when we finish up our vaccine clinics. Within 30 minutes of being notified, and to answer your phones or read your text so that you know about it. We'll now move on to the local COVID-19 situation. We have 35 confirmed cases since yesterday's report. We have 979 active cases. 34 Knox County residents are currently hospitalized. And very sadly, we have 5 additional deaths to report today, raising our total to 614. Now we'll review the weekly benchmarks. I skipped a paragraph. Ahead of this holiday weekend, I urge everyone to continue to follow the 5 core actions, and please get vaccinated when you can. Whether we realize it or not, our actions have a very real impact on our community. Now I'll move on to the weekly benchmarks. As a reminder, all of this data is available on our website at covid.knoxcountytn.gov. Now, the first benchmark, sustained reduction or stability in new cases for 14 days. For the past several weeks, this benchmark has been green due to the lower volume of new COVID-19 cases across our community. However, in the past 14 days, there were 7 red flags. 4 of these were on consecutive days. This is an indication that average case counts are increasing. Because of this, we've downgraded this benchmark to yellow. Our second benchmark, community-wide sustained or increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding lab turnaround time, this figure remains less than 2 days on average. For the volume of tests, we saw a slight increase from the previous week, but we continue to keep a close eye on this metric. Because of these factors, we continue to report this benchmark as yellow. Our third benchmark, sustained or increased public health capability. During the past week, more than 27,000 vaccinations have been administered. That's up from 25,000 the week prior. We continue to see an increase in the total number administered every week, which is exciting. As you can see, we are trending in the right direction. For those reasons, we are representing this benchmark as green. It's important to point out that this benchmark is designed to measure progress and improvement. I want to be very clear. This does not mean we're near herd immunity or that we can stop following the 5 core actions. Our fourth benchmark, healthcare system capabilities remain within current and forecasted surge capacity. Over the couple of weeks, we have seen the number of hospitalized COVID patients plateau, which is concerning. However, hospitals are still within their capacity. After speaking with our hospital partners, they have recommended that this benchmark continue to be represented as green. Our fifth benchmark, sustained or decreased COVID-19 related death for identified positive or probable cases. Since the beginning of March, there have been 30 deaths and an average of 1 per day. The information available leads us to represent this benchmark as yellow. Under our supplemental data section, the first chart shows new COVID cases per 100,000 population. As of yesterday, our 14 and 7-day trend lines show 11 new cases per 100,000, both of which have remained fairly constant. The second chart shows the percent positive for COVID. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County is just under 10%. Before I open it up for questions, I want to take a few minutes to reflect. As I've said before, over the years, when we've planned for pandemics and large-scale responses to infectious diseases, I never anticipated the rhetoric and politicization to be so as considerable and, quite honestly, as dangerous as it has been over the past year. So many decisions, opinions, and frustrations have been born from misinformation. Though we are certainly not perfect, we've tried our best to clarify so much of this inaccurate information. But at times it seems that there's just too much of it from too many different, powerful, and loud voices for the facts to stand a chance. The adage that a lie can travel halfway around the world while the truth is still putting its boots on seems to have more meaning now than perhaps any other time in recent history. And while it is incredibly disheartening, we remain committed. We will continue to work every day to do what's right, to share accurate information so the public can make informed decisions, and work diligently to protect our community. So as we head into what for me is a very personal holiday and important holiday, I encourage everyone on all sides of the debate to seek first to understand, to pause before making assumptions, to show kindness to your fellow community members, and to remember there is no us and them. There is only us. Now I'll open it up for questions.
All right, for the media members who are on the chat, if you'll go ahead and submit your questions, and if you'll identify yourself as you do so, which agency you're with, that would be helpful. Up first from Brian Hornback, the question is it true that Dr. Pat O'Brien has resigned from the Board of Health, and what position, speciality, does his position on the board represent?
According to what I've read in the paper, Dr. O'Brien did resign from the Board of Health. And so I have to remember the makeup of the Board of Health off the top of my head. I believe he is one of our physician representatives. There are 2 physician representatives on the Board of Health, and he's one of those. Those positions are nominated by the Knoxville Academy of Medicine. And so that's what I know about that.
All right, from Scott with Compass Knox, how will Dr. Buchanan handle the existing public health orders? There's a few here.
Okay.
Will she have to issue new orders identical to the existing ones? If so, when will those orders be issued? And does she plan to alter the orders? So how?
So what I know right now is that the new ordinance does not take place, not go into effect for 15 days after its passage. And somebody in the room can tell me what that date is because I can't remember off the top of my head. And so right now I'm what needs to happen next, and understanding from the law department that the current regulations stay in place for these 15 days. I've requested a meeting and I'm waiting to hear back on that meeting with the law office.
All right, second question from Scott with Compass. Has Dr. Buchanan spoken with Mayor Jacobs? And if so, what can she tell us about the conversations?
I haven't spoken directly to Mayor Jacobs. I've spoken to the folks in his office, Dwight Van Veen, Chris Caldwell. And we talked about the fact that we really need to get together with the law office to clarify really what's next and what the guidelines are regarding the board, regarding my position as it relates to the legal limits and legal authorities.
Allie with KnoxNews. Is Knox County still getting the expected increase in vaccines next week? And how many doses do you expect to get and of what brands?
So we really don't determine the brands. That's determined by the state and actually by the distributors and the federal government and lots of other people outside Knox County. We anticipate that our supply will probably kind of level off a little bit and not be increasing as it has been. That's what we were told by the state yesterday, to anticipate that the amount of vaccine we're receiving to remain relatively flat. So maybe anticipate small increases, but not increases like we've seen in the past. Because in the past we've had bigger increases. We will continue to allocate those to providers who need them. And as far as I understand, it'll be all varieties of types of or brands of vaccine. So Pfizer, Moderna, and J&J will be coming into the county, and the providers who've been activated will be requesting supply, and the state will make that final determination.
All right, Annie from WBIR. Should we be concerned that new cases is at a yellow light on the benchmarks?
I think it's a reminder to all of us that COVID is still very present in our community and very active in our community, and that we cannot let up our observance or following of the 5 core actions. We all of us as a community, for the health of each other, need to continue to observe and practice the 5 core actions, whether you're vaccinated or not. I'm fully vaccinated and I observe the 5 core actions every day to reduce risk to others.
All right, Allie with KnoxNews. Have you gotten any recommendations to improve the health department's internal processes from the Pew investigation?
It's going to be a couple of weeks or so before that is finalized. So we'll wait till we get that final report. So I don't have anything yet. It does. Okay. Sorry. Pew is one thing, but we are an organization that practices continuous quality improvement. And the moment we knew that an error had occurred, we began evaluating our processes and making corrections. And we've put new things in place. We've talked about some of those, increasing the number of people who are involved in receiving vaccine. And we have a system to help track vaccine better. The sheer volume of vaccine that we're receiving is much higher than normal. So those are things that are very important. So we're doing all of those things, and we'll continue to constantly look at that process to make sure we don't need to tweak it more to make it more, put some more safeguards in place.
Austin with WATE. Is the former waitlist technology being rolled over to the new form of signing up? If not, was that money well spent?
So to answer your first question, the short answer is no. We believe that money was well spent. It helped us create a wait list, which helped people be able to get on there, and we've been able to work through that list and give those people appointments. But what we're excited about with the new system is that you won't be just getting on a wait list. When you go on there, you'll be able to get an appointment. If you can't get an appointment with us, then you go to vaccinefinder.org. You can probably get an appointment with somebody else.
Annie from WBR, why is KCHD moving to an appointment-based system? Can you walk us through how it works?
You go online and you click on it and you look, and it brings up possible appointments, and you sign up for one of those appointments. It's pretty that simple. You look at your calendar, you look at what's available, and you sign up for one of those time slots. We break it out into time slots. You won't get like a 10-15 appointment. You break it down into time slots, so we allow so many appointments per 15-minute time slot, and I don't remember what that is. And if you can't go online to do it, you can call 215-5555, and they can help you make an appointment as well. It helps increase access. The wait list was really honestly a management challenge for the community and for us. People got on there, and sometimes they would accidentally register themselves a couple of times, and it was a little hard maybe to take yourself off if you got another appointment somewhere else. So we spent a lot of time. I think we've said that at one point, I think I was told that we had to send about 4,000 notifications to fill like 400 slots. So that was a lot of notifications. So this way people can go in and get their own appointment. It's what our partners across the community are doing, and people across the state are doing. Again, moving away from that wait list. And now that it's open for everyone, everyone's eligible to get a vaccine. We want people to get an appointment that's convenient for them.
All right, a few more from Annie with WBIR. How many volunteers do you all use per vaccine clinic? And are those spots being filled, and how do you sign up?
Okay, how you sign up is to go to volunteer.
Hi, this is Charity in the background.
Yeah.
It's our Medical Reserve Corps volunteer registration link, and we can get that to you guys because I don't know the actual exact web address. I don't want to get it wrong.
Yeah.
It's how you sign up.
Sure, thanks. So we can also look at from our staffing team what the average number of volunteers we use per clinic. It varies, obviously, because people aren't always available. So we can get back to you on that average number because I'm just not sure what it is, and I don't want to give you inaccurate information. Those slots are being filled. We still need more people to sign up. We've actually seen a little bit of a drop off in availability. So we still need people to sign up, and we need everybody from people who can hold the door open and welcome people to people who can give a vaccination or respond to something that happens. So we need people who can help citizens fill out their paperwork and help them make their way through the clinic, screen for symptoms, people who can get vaccine, and lots of different things in between. So you don't have to be a medical professional to help out. You have to be somebody who's willing and wants to help our community.
All righty. A couple more from Amy with WBIR. Should you laminate your vaccine card?
If you want to. I've heard of people doing that. I think you need to consider the fact that you might need to be using it for things going forward. You might need to be using it for activities or access going forward. So if you want it to last, you might want to laminate it. So that's something you can consider doing personally.
And it's the marathon question. If the pandemic is a marathon, what mile would you say we are on?
I don't know that I can give a mile. I think that we've obviously passed the halfway point. But if we don't continue to observe the 5 core actions, we're going to have to go back up that hill. And nobody wants to run backwards in a marathon.
Allie with KnoxNews. Are you no longer planning to continue using the waitlist technology for future vaccinations like the annual flu shot? Will you use the new system coming out on Monday instead?
We haven't really had to use those kind of systems for flu shots. I think the registration system might be used for our school flu if we continue to do that, or if we do big clinics for flu. But we really haven't ever had to do a wait list for flu. Unfortunately, fortunately, flu vaccine is very available throughout the community. And so people don't really need a wait list to get access. The reason to have a wait list is you have a limited quantity of something that a lot of people want. So then you create a wait list. And we still have a limited quantity, but everybody can have it now. So shifting to an easier, more streamlined process made sense.
All right, do we have any more questions from the media? They can go ahead and submit those into the chat feature. All right, seeing none, we will talk to you next week. Thanks, everyone, and have a safe and healthy holiday weekend.